presentations and has organized 35 international events on biotechnology and biosafety. We welcome him today to give his webinar presentation. Pedro, please check if we can hear you and see your presentation, and then you may present.
Okay, good morning, everybody. Thank you for coming, and thank you, Hector, for the invitation and your kind introduction. I'm going to share my screen.
Yes, please go ahead. You can do that.
Perfect.
Yep, we can see it.
And in order to avoid any kind of problem, I will stop my video and I will start right now.
Great.
Okay. Thank you very much for the invitation and for your presence here. In the next minutes, I will share the presentation IICA as facilitator in preparatory COP and COP-MOP discussions in the Western Hemisphere, in which I will start with a brief introduction about IICA, followed by a regulatory context regarding GMOs and genome editing, as a way to illustrate the heterogeneity in terms of countries and regulatory considerations. With that, I will present how IICA is technically contributing to the COP-MOP discussions, in particular for the preparation of COP15, COP-MOP 10, and MOP 3, sharing with you a summary of the internal discussions and ending with some remarks. The Interamerican Institute for Cooperation on Agriculture, IICA, is the, let me check here, is the specialized agency of the Interamerican system for promoting agriculture and rural welfare. In a similar way that the United Nations has FAO, the Organization of American States has IICA. IICA was created 80 years ago, and in that sense, we are one of the oldest multilateral institutions in the world. The Institute's constituents are the ministers of agriculture of the 34 member countries through what is called the Inter-American Board of Agriculture, IABA. What does IICA do in biotechnology? IICA acts in biotechnology following the IABA mandate. We are an independent and timely channel for exchanging information, and we work in a jointly manner with public agencies, research institutes, universities, and private sector in the countries. We carried out 3 types of actions that will be explained in some detail later today. We are having actions related to institutional support, biosafety training, and efficient communication of biotechnology. I would like to reflect on how science and technology and innovation are seen as vital for human survival. However, although science, technology, and innovation are very important, they are not sufficient. And at least another element must be taken into consideration: the institutionality. Institutionality understood as both institutions and instruments that at the end make the things functioning. So, under IICA's view, agricultural transformation will require a closer and stronger interaction between science, technology, innovation, and institutionality in order to respond in an efficient manner to society's growing demands. After this institutional introduction, I think it's important to set up the regulatory context of biotechnology and biosafety. Biotechnology, defined by the Convention on Biological Biodiversity, as you can see here, as any technological application that uses biological systems and living organisms or derivatives for the creation or modification of products or process for specific uses, has become, without exaggeration, one of the most important strategic tools for the development of humanity. So, Under this broad definition, many activities can be considered biotechnology. In addition, because of the potential risks proper of any technology, and biotechnology is not the exception, there is a growing and valid interest to guarantee the safe use of biotechnology, the safe use of its processes and its products. And because of this concern, biosafety concept has been developed and consolidated. So biosafety has been defined as the broad range of measures, policies, and procedures that address the preservation of biological integrity, minimizing the potential negative effects or risks that biotechnology tools may eventually pose to the environment or human health. And as we see here, several regulatory instruments deal with biotechnology and biosafety under two approaches, the environmental one and the food safety. The international regulatory instrument dealing with food safety is the Codex Alimentarius. Regarding the instruments dealing with biosafety to reduce potential risks to the environment include the Convention on Biological Diversity, the Cartagena Protocol on Biosafety, and the Nagoya Kuala Lumpur Protocol on Liability and Redress. Going deeper into these instruments, and knowing that in previous sessions, Felicity and Pete were explaining with more details, I want to mention that the instruments based on environmental interest, like the convention and the others, are very relevant, and they are having an environmental point of view. The CBD establishes that all states have sovereign rights over their biological and genetic resources. And in Articles 19 and 8, the convention refers to LMOs. From there, biotechnology is seen as an issue of environmental interest. The Cartagena Protocol seeks to ensure the safe handling, transport, and use of living modified organisms, focusing on transboundary movements. And a third protocol, the Nagoya Kuala Lumpur Protocol, seeks to answer the question of what would happen if transboundary movement cause harm. In short, we have regulatory frameworks with a rational and interest in environmental protection. And here, I just wanted to mention that there are two protocols that must not confuse. Nagoya Protocol, related to equitable sharing of benefits, and this protocol is different to Nagoya Kuala Lumpur Protocol. It seems obvious, but in certain countries, such confusion has originated legal misunderstandings, and that is why I am bringing here this statement. Several Latin American countries or Western Hemisphere countries are bound by these international commitments, and I hope you can see the countries in this table. And what I would like to emphasize here is that when a country ratifies a convention by means of a national law, the international expression is materialized in a national legal instrument. And something very important is that these international conventions are not straitjackets, but offer general guidelines so that each country can interpret and implement actions regarding GMOs, for example, according to its own institutional and legal framework. That is why we have heterogeneity in the implementation of the Convention of Biological Diversity and Cartagena's Protocol on Biosafety in the countries. And it's something that you can see here in this slide. The important message here is that independent of the interpretation, we expect that when the same GMO application is presented in different countries and the conceptual elements of the analysis are the same, the conclusion will be very similar. And with that, trade barriers are either avoided or overpassed. On the other hand, a new chapter must be taken into consideration, the genome editing, a technology with different names, which can be a problem under the regulatory point of view, and technologies very precise, but more complex to explain in detail, which could be an issue for communication and training purposes. The important fact is that genome editing is an example of genetic manipulation, but is different to genetic modification based on transgenesis. From the regulatory point of view, genome editing is a technology whose products are evaluated in a case-by-case basis and inquiring about their transgenic nature or not. Up to now, it seems there is no need for a new category of products derived from genome editing. And as a result of these considerations, several countries in the Western Hemisphere have regulation that promote the safe use of genome-edited products. With this context, it is noteworthy to mention that regulations have multiple roles, the most important of which is to protect public health and to guarantee safety. They also help to instill trust in the food supply, and in addition, effective regulatory approaches also encourage innovation. Here, it is relevant to mention that the regulatory approach that the country chooses determines which of these tools are available to the farmers. Regulations and regulatory approaches should be science-based, risk proportion, and they should also be defensible, credible to the public, because the public concerns, as we all know, may reflect non-scientific concerns or value-based issues. If regulatory processes are to encourage innovation, they must also be timely and predictable, and transparency is needed both to encourage innovation and also to instill public trust. And effective regulations must protect public safety and allow production and marketing of safe products. This is easy when regulatory approaches are harmonized among training partners. However, it is essential to recognize the heterogeneity. Countries have developed different effective regulatory approaches, and there is no one best approach. There are differences in existing regulatory structures and legal enabling authorities, as well as different philosophies. There are different regulatory triggers, for example, the product versus process when GMOs are being considered. It is important to recognize the oversight by different authorities, ministries, agriculture or fisheries, environment or food, or shared oversight by multiple ministers or even multiple countries. What must be general agreement is on what needed to be evaluated or regulated. What is important to regulate? With the advent of genome editing and genome sequencing, we are now looking at a very different scientific landscape than we have with the GMOs or transgenics in the past. However, regulatory goals remain the same, and all products, either biotech or conventional, must be safe for humans, animals, and for the environment. Regulatory approaches reflect characteristics and potential risks of products coming from new technologies, and regulatory frameworks allow safe products to be used by farmers and be sold and traded in the global market. Before the end of this section, I want to reinforce the idea that there are many different aspects that must be taken into account when use of biotechnology is considered. However, it is vital to recognize and differentiate realities based on facts from myths based on beliefs, because we need to remember that from this differentiation, we will end up with several consequences. Up to now, the importance of institutionality and details about the use of some instruments, such as the Commission on Biological Diversity and Cartagena Protocol on Biosafety to deal with GMOs, have been pointed out. In addition, the facts related to genome editing and the role of regulations recognizing heterogeneity of countries have been taken into consideration. And with all these elements as background, I would like to deal in how IICA has contributed and is contributing to the development of biotechnology for future agriculture. IICA actively works on three types or group of actions. First, by either organizing or supporting exercises for efficient communication of biotechnology. As a result, IICA organizes, co-organizes, or supports seminars, workshops, or related activities in order to clarify basic concepts or to show uses or applications of biotechnology. The second group of actions focus on providing training in specific issues. For instance, in biosafety on topics such as risk assessment, synthetic biology, genome editing. In terms of training, education, and communication of biotechnology and biosafety, you can see here details of a seminar on risk assessment in which we were able to mobilize 42 regulators from 20 countries to visit the ponds containing genetically modified salmon. In 2018, details of the seminar on genome editing for hemispheric regulators that was held in Cali, Colombia, with 87 people. It's very important to mention that from this seminar, it was proposed the basis of the International Declaration on Agricultural Applications of Precision Biotechnology, which was presented to the Committee on Sanitary and Phytosanitary Measures of the World Trade Organization. In GR 2020, we were able to conduct a practical training in genome editing in a joint activity between IICA and the Alliance Biodiversity SIAD in Colombia. And in 2 weeks' time, we will be carrying out a new laboratory course on genome editing in Colombia. And for the third group of actions, and more relevant for this seminar today, IICA contributes providing technical support to the national institutions. For example, by reviewing policies and norms, proposing adjustments to the regulatory frameworks, and supporting countries in the preparation for participation in international fora, such as the Convention on Biological Diversity and Cartagena's Protocol, the OECD, or the WTO, between others. And here you can see several examples of these national, binational, and regional initiatives, some of them involving GMOs, other related to genome editing, and even some initiatives regarding biological inputs for agriculture, which are relevant for organic agriculture, agroecology, and modern agriculture, because biotechnology is a basis for all forms of agriculture. And regarding the preparation for participation in international fora, IICA has been facilitating these discussions since year 2006 through in-person meetings carried out here in Costa Rica, in which around 18 to 20 countries are participating, and we are inviting around 40, 45 people, the majority of them being regulators coming from the Ministries of Agriculture and sometimes coming from the Ministry of Environment. During these pre-COP meetings, the CBD and PCB topics are explained, discussed, and eventually a reference document is generated. For the COP15, COP MOP 10, and MOP 3, the in-person meeting was not possible for, as you know, COVID restrictions. And for that, 18 virtual events were carried out starting on January 2020. You see here the list of these virtual sessions. And each session usually has the following structure. First, an update of the intersessional activities. And that part is kindly being presented by Piet van der Meer. And then we have a technical development of a particular key topic. And for that, we invite different specialists. After listening all this information, we finish with an open discussion and what I call a tour between countries from Canada to Argentina, giving the opportunity to the participants to express their ideas. However, they are not expressing the position of the country. It's just an exchange of ideas. And in order to do that, they are going to have information to be able to transmit and to discuss internally in their own countries. For the interest of today's seminar, I want to tell you that we had a session on the gene drives on March 2020, and you can access all the material and the discussion in this Google site. You will be having the presentation and you will be able to access it. And now I would like to share with you some of the messages and ideas taken from the virtual discussions of these 18 virtual sessions I was mentioning before. You can see here that the messages are written in both English and Spanish. And this is because sometimes the messages can be distorted by the language. The two general messages of these virtual sessions were, the first one, it is important to participate in SABSTA and COP-MOP meetings because decisions are taken there and silence implies acceptance. And the second message, the second general message taken from the discussions with the group in the 18 sessions is that virtuality demonstrated to be useful for exchanging information during the pandemic period. But there is a consensus that decision-making should be done in person at COP-MOP 15. Regarding the general topic, the post-2020 Global Biodiversity Framework, participants in the IICA virtual sessions pointed out that it is good that the COP-MOP sets out an ambitious, forward-looking program of work. All of us recognize that. But regarding biotechnology, the Global Biodiversity Framework should, consistent with the Convention of Biological Diversity, underline that access to and transfer of biotechnology is key to asserting the Convention objectives. And with regard to biosafety, the Global Biodiversity Framework should bring Target 17 more in line with the Convention preamble, among other things, but by underlying that modern biotechnology has great potential for human well-being if developed and used with adequate safety measures. And of course, these were some of the ideas coming before the meeting of Geneva in March this year. And in our next session on 26th of May, we will be discussing all these points, and we will be reviewing some of the conclusions from this meeting. On specific topics from the Convention and Nagoya Protocol, participants concluded that regarding synthetic biology has the potential to contribute significantly to many of the Sustainable Development Goals. And any discussions by COP should be balanced in addressing both the anticipated benefits and the potential risks. Another idea from this specific topic related to synthetic biology is that it is important to facilitate international cooperation, promote and support capacity building, technology transfer, and knowledge sharing regarding synthetic biology. The third idea is that the discussion about synthetic biology under COP is hampered by the fact that there is no agreed description of what synthetic biology is. And for us, in our discussions, it was quite clear that up to now, all products from synthetic biology are falling in the category of genetic modified organisms. Therefore, according to the discussion, maybe it's not a need to generate a new category of products or to deal with a new protocol in order to deal with synthetic biology. Because according to our discussion, synthetic biology is included in Cartagena's protocol. But this is the kind of topics that we are discussing during that kind of meetings. Regarding specific topics, we were discussing about risk assessment and risk management of living modified organisms. And here are some of the ideas. While substantial experience from countries in the region shows that environmental risk assessment methodology of the Cartagena's protocol is adequate for any type of living modified organism, additional guidance material, but not guides, may be useful to conduct environmental risk assessment in an efficient and timely manner. And here is important because in the discussion, the people, they are not asking for new guidelines documents. They are more interested in having case studies, like real life studies. And I think it's important to clarify that. Another idea that came from this discussion is that guides documents, these guidelines, lose their value if they are transformed into prescriptive documents. There is another idea mentioning that there are sufficient guides materials for genetic modified fish, for example, but guidance material like study cases for organisms with engineered gene drives may be useful. And the fourth idea is that it is important to facilitate and to support capacity building and knowledge sharing and technology transfer regarding environmental risk assessment of living modified organisms. As a cross-cutting topic, genome editing was considered, and here are some of the statements. Genome editing has the potential to contribute significantly to many of the Sustainable Development Goals. According to our discussion with the group, there is no need of a new regulatory category for genome-edited products, as it has been shown for Latin American countries that have already accepted and introduced this kind of products without a new legislation or a new category of evaluation. Another point is that while genome editing can be used in synthetic biology and in developing gene drives, genome editing should not be equated with synthetic biology or gene drives in order to avoid confusions or in order to generate like a misunderstanding of the technology. And to conclude, some messages that IICA uses to reinforce both the importance of biotechnology for agricultural development and the idea that the impact of international frameworks on national regulations and decisions are quite relevant. So, technology in general and biotechnology in particular are essential for sustainable food production and the various forms of modern agriculture and animal husbandry. Biotechnology have developed several tools that can be used by farmers. That is one very important message that we as IICA are fostering, promoting, and sharing in our events and outside these events. Another message is that modern biotechnology is safe. And this is guaranteed by the application, the strict application of regulatory frameworks. And for us, it's clear that the absence of regulatory frameworks or restrictive regulatory frameworks or restrictive regulation generates a vicious cycle of illegality, and nobody wants to have illegal products in its territory. Another idea is that regulatory frameworks guarantee that each event will be analyzed based on technical scientific arguments and make the technology available so that producers who want to use it can do so. Ideally, regulatory approaches should enable safe products to reach the market, encourage development of new ideas and innovations, and provide opportunities for farmers to incorporate innovations into the production system in a sustainable way. Future agriculture will require a closer and a stronger interaction between science, technology, innovation, and institutionality in order to respond in an efficient manner to society's growing demands. International frameworks must be interpreted by the countries recognizing its own specificities and aligning to its national rules. Both scientific and regulatory training and communication must be reinforced to different groups. And in that sense, regulatory cooperation is a key element for closing the gaps between countries. And precision biotechnology is overpassing certain technical and regulatory limitations. And with precision biotechnology, that is to say with genome editing, it will be necessary to take practical routes to product-based rather than process-based decision-making. Regarding gene editing, it is a new era of biotechnology framed by precision. It is being developed on the basis of scientific rigor, recognizes the importance of biosafety, and this is very relevant. Genome editing will not be able to develop under restrictive regulatory frameworks. And that is why we consider that the Convention of Biological Diversity and Protocol of Cartagena are discussing on issues such as risk assessment, genome editing, and synthetic biology. And hopefully, COP/MOP meetings will take decisions that guarantee both safety and technical development. And I hope I have been able to present how IICA is trying to contribute to the COP/MOP discussions by facilitating the interaction between countries of the Western Hemisphere. And if you have any questions, I will be happy to answer them. Thank you very much for your attention. And Hector, the floor is yours. Thank you very much.
Thank you. Thank you very much, Pedro. I appreciate your presentation. And at this point, I'd like to encourage anyone who has a question to either write it on in the chat or raise your hand. And I see we have one already who's raising his hand, and so I will allow David to speak. Can we have David enabled? Go ahead, Dave.
Thank you, David. It's an excellent question because, you know, even though we as IICA, we are facilitating through this platform to put together the countries in order to discuss about specific issues that will be discussed in CBD and Cartagena's protocol, etc. We are not or the countries are not generating like a common position. And what we are, and for us, that is fine. What we have found is that this platform and this initiative is very useful to identify like the group of countries with specific ideas on particular topics. And by doing that, when they are participating in the COP scenario, they have very clear statements. And some of these statements will be supported by countries from Latin America, but it could be being not supported by other countries of the same region. In that sense, we are not acting like countries in general of the African Union. When you see how they are acting in these meetings, they are acting sometimes like a bloc or the European Union. In that sense, in Latin America, no, they listen each other, but they are preparing their own position. And you can identify like a group of positions during the meetings. And some people were telling me last time, oh, but maybe it could be frustrating for IICA to have these kind of things. And no, actually for us, it's very interesting to see how the countries are progressively having an evolution in order to the importance of the discussion at internal level and how they are preparing and defending their own positions. And some of them start to interact with other countries, but in all times, we are recognizing and defending the heterogeneity, because we recognize that every country is different. Every country is having the like sovereign positions, and we respect that. And what we are doing is just providing the platform of discussion. We have seen that for some topics, independent, they arrive to the same conclusion. For example, how to deal with genome editing products. The countries are saying, look, we don't need a new category, because essentially you can manage under the regulatory point of view, a genome edited product as, okay, is a GMO or is not. And it has been quite interesting how they have arrived to the same conclusion, thanks to the fact that they have been participating in this kind of seminars and exchanging information activities. Therefore, when the countries participate in these COP meetings, at least for Latin America, even though we have the GRULAC group and is trying to provide another platform during the meeting in order to exchange ideas, I think it's quite healthy to have this diversity of positions, because it's respecting the heterogeneity of the countries. And I hope this long answer respond to some of your comment and your question. Thank you.
Yeah, and actually that's quite an interesting thing to point out, that the Latin American countries, unlike the EU or the African Union, don't necessarily have a sort of a block type approach to the negotiations. But that then points out something which I think is important to understand, and that is that, for example, on the issue of bans on particular things like gene drives, those who are doing research on gene drives have been concerned by efforts by certain groups to introduce language to either ban or restrict it at the COP level. And so I'm interested to know whether there is, a similar kind of there are sympathies in certain countries, for example, in Latin America for that type of thing. I noticed, for example, that there have been bans on on agriculture as well, on certain forms of agriculture in different countries there. And so I'm seeking your views on whether or not that is likely also to happen in certain countries with regard to these new technologies.
Yeah, Hector, thank you. This is a very important point because, this gene drives technology is one of the hot spots, and everybody is talking. And internally, at level of the countries, internally, depending of the country, they are having very strong discussions because there is a group of people inside the countries that they are supporting the development of the technology because they say, look, this technology could be quite useful, not just for human health purposes or animal health purposes. We could use the technology in order to control, to improve the environment in terms of controlling rodents, for example, or even improving the crops and the agriculture, because you can use the technology in order to avoid the dissemination of pests and things like that. And there is another group of people inside the countries that are mentioning that, oh, the technology is quite new and we don't know the risks yet. And these are the two main ideas behind their position, and they are talking. What is happening in the countries? And I would like to show here that depending on the main advances in biotechnology regulation or biosafety regulation has been done in the agriculture sector. And you see here a summary of the regulations in Latin America dealing with GM crops. And we have countries, or we have a different group of countries. We have countries with a very pro regulatory framework that allow the entrance of genetic modified crops. And in some countries, by extension, they start to consider other GM products as gene-derived products. As an example, we have in Central America, Honduras is the most advanced country and with more experience in approving GM crops, and they are interested to explore and eventually to authorize another GM products, such as a GM mosquito for health purposes, to control dengue, chikungunya, yellow fever, etc. We have some other countries like Guatemala that has a relatively new regulatory framework that allow the confined studies of GM crops, but they have taken decisions on genome edited products as well. And based in the latest chat I had with some of the regulators there, in Guatemala, they are interested to explore the use of other biotechnologies, and gene drives is another chapter that they are interested in, because they see opportunities not just for development, but just for transfer the technology and help the people with the technology. There are some other countries, and the countries that you see here in red, in which they are having like a kind of anti-GM position. And this position, even though was stated for crops, is being extrapolated to any GM product. For example, Venezuela has a strategy, a national plan to eliminate the use of GMOs in agriculture production, but by extension, they are not considering gene drives as a good opportunity in order to deal or to overpass certain kind of biological problems. Bolivia is an interesting example. They are banning GM crops, except soybean and sugarcane. But when you talk about genome editing or gene drives, they are not interested to even start the discussion on this topic. In Peru, the 15-year moratorium that was presented last year is interesting. They don't want to know nothing about GMOs. However, they are interested to know more about genome editing. And eventually, if you are having, if they generate like a kind of resolution or regulation to deal with genome edited products, and you have gene drives derived from genome editing, eventually you could have an opportunity. But in this moment, it's not possible. Ecuador has a constitutional ban on GMOs, but they have in another law, essentially the organic law of the environment, they open the possibility to work with another biotech products that are not qualified as GMOs. In that sense, a genome edited product or a gene drive derived from genome editing could be presented and evaluated in Ecuador. And depends a lot of the political situation and how the authorities in a particular moment are considering biotechnology in general terms and GMOs in specific terms. I hope I have been illustrating that response. And just mentioning here that regarding genome editing regulations, and that is why in some countries they are interested, or at least to have the discussion about gene drives related to genome editing, are countries like Argentina, Brazil, Chile, Paraguay, Colombia, Ecuador, Guatemala, Honduras, and United States and Canada. And these are the countries that in this moment they have a kind of regulation that allow them to deal with genome edited products. And that could open the possibility to work with gene drives.
Great, thank you so much for that answer. That's very thorough and really illustrates the heterogeneity, but yet it also illustrates how these even though you bring them together with the different views, you can actually provide a platform for them to exchange their views.
Yeah, and Hector, it's interesting because I think that is our task. We don't care if a country is pro or is against a particular technology. No, at the end, what we are interested in is for these countries to implement a clear regulatory framework in order to implement the sovereign decision on this technological topic. And I think that is important because the countries sometimes maybe the decision to ban a particular product or technology is not a technical one. It's more related to a social, economic, or even political or ideological idea. And we need to respect that. But I think that is why we as IICA, we have been able to bring all these different positions together, because we are not qualifying or disqualifying or judging positions. No, we are just listening and allowing them to exchange information. What are they doing with the information is their business. The important thing is that they receive the information and at least they know the things that the other countries are considering and are thinking. I think that is very, very important, at least for us.
Great, thank you so much. I'm going to ask Willie Tanui's question here. He says that in the part of your presentation that has to do with risk assessment, you've proposed or you have mentioned that guidance, according to SUBSA, is necessary for organisms containing gene drives, is necessary or may be necessary for organisms containing gene drives, but not for GM fish. Could you please clarify if the risk assessment guidance for fish, or could you please clarify how that conclusion came about? I guess it could either be to try to explain how SUBSA came to that conclusion, but also whether that's also the position that you have heard other countries in Latin America espouse.
Thank you, Hector. And I think here that is the question from Willie. Thank you, Willie, for the question. Okay, regarding the risk assessment guidelines, as you remember, in Mexico, in the MOP in Mexico, year 2016, there was
Yeah.
the presentation. The Secretariat presented a guideline document that was expected to be approved there. But that guideline was not approved. And I think that based on that experience, because in order to present that document, the Secretariat and the work spent something like 6-8 years, and at the end, nothing happened. And based on that experience, is that at least the people from Latin America, or at least the people that we are inviting in our meetings, they said, look, there are many different guidelines for dealing with environmental risk assessment. And each guideline is saying what to do and how to do it and all these kind of things. And there are a kind of general principles to do the environmental risk assessment. What they said is that more important that the guideline document could be more useful to have examples of specific cases and how regulatory frameworks in countries with more experience have approved or rejected a particular event. Because by doing that, they are going to be able to see in practical terms what is relevant, what is not relevant. And that is the idea behind. Regarding guidelines for GM fish, they said, okay, there are some guidelines, documents that explain how to do it. Again, they said it will be very useful for us, at least for the countries with not a long history of approvals, to know how countries with more experience, like Brazil, like United States, Argentina, they are approving these specific events regarding GM fish. The same happened with gene drives. They said, look, we need to avoid to have these guidelines, very heavy guidelines that could not be applied because they are containing many basic concepts or they start to be not clear. And more than this guideline, we could have a specific case that could be that was analyzed by a country that authorized that particular event. And by doing that, we are going to be able, we as regulators, they said, we are going to be able to analyze in a deeper and in a proper way that event that eventually could enter to our country. That is the idea behind this differentiation between mandatory guidelines and these examples of specific cases. Another thing that they are saying, look, mandatory guidelines is a big risk because each country is having its own situation. And it's good to have like general principles. And they said, for example, Annex 3 of Cartagena's protocol is providing like general views that we need to take into account. But each country, depending of its necessity, its requirements, its legal framework, adjust some of these elements and give priority to some or other elements. And by doing that, they feel happy because they are taking its own decision. I think that is the idea behind all this discussion about guidelines. And the countries, they say, we need to have more specific cases as examples of real life in order to illustrate us how these advanced countries in regulation took decision. And this topic is very well related to the need of training. Countries are requiring, I think that is a general comment that is jumping from these meetings. All the countries are asking for training on risk environment, for example, environmental risk assessment. And they said, look, more than having a series of seminars saying, oh, risk assessment is this, and you need to have these principles and things like that, we will be more interested to have like a kind of workshops in which the experts, regulators arrived and show us how they were dealing with specific cases, and what were the main barriers, the main constraints, the main points of discussions, and how these regulators in other countries overpassed these limitations. That is the history behind this specific statement that you saw as element in the summary of the discussions.
Good, thank you. I'm going to circle back to that and the guidelines and developing guidelines versus examples. But I'm at this point I'd like to turn it over to Dave, who's raised his hand again for his question, following up on this item.
Mm-hmm. Yeah, you know, David, is interesting because remember that before the mosquitoes were released and the experiment in Juseiro was carried out in Brazil, the mosquitoes were released in another countries, like if I remember well, in Indonesia or something like that, and they were doing some testing. Brazil was doing the testing and published the results. The results were quite positive. And it's interesting because in the events we have been organized, not just for preparing for COP, but for other technical events, we have invited Brazilian regulators to talk about their experience dealing with the approvals of this mosquito. And in general, the regulators from the countries of Latin America, they are quite receptive and they say, oh, this is quite interesting, the technology, and it will be nice to explore in the future that kind of technology in our countries. I remember that after they present this information, there was a peak of chikungunya and dengue. And some countries approach Brazil and the companies, Oxitec, in order to know more about the technology. And I know that some countries, that Oxitec has been in conversations and has been approaching the countries in order to present the technology. In some countries, they have discussed and even they have implemented some field trials. But based on the results, the countries are saying, no, you know, we are not reaching the level of protection that we wanted. Therefore, for now, no. In some other countries, they are. I know that they are. They have been receiving some delegations from Oxitec, and they are talking about that possibility. Something that is, I think, is the key element is that the regulatory frameworks for biosafety are quite clear in the majority of countries of Latin America for dealing with crops, with agricultural purposes, but not for dealing with health or environmental purposes. And in some countries, even though they have a very clear regulatory framework for agriculture, when Oxitec or a company arrive to talk about gene drives and to work on malaria or something like that, they have like a barrier, a regulatory barrier, because they say, oh, we as Ministry of Health, we are not dealing with this kind of events. And because they are not having regulation at the level of the Ministry of Health, some of these initiatives are truncated. That is why in some countries, we have received some messages from the Ministries of Agriculture saying that it will be good if we can work with the units or officers in charge of human health in order to try to propose some regulations on human or health biotechnology. And I think that is something that is very important. We have countries in which, actually, I know a country that is saying is having a very good regulatory framework for biotech, and they are asking to Oxitec for mosquitoes, genetic modified mosquitoes, to overpass some problems related with flies in cows and things like that. And they say, look, we need this technology. And in that moment, Oxitec say, oh no, we are more focused on human health. Therefore, I think there is a good space for new developments in terms of using, for example, genetic modified mosquitoes for controlling diseases in animals or vectors for diseases in plants. And there is a good opportunity to work in regulatory frameworks for using the technology with different purposes, environmental point of view or human or animal health.
Yeah, good. And actually, so I want to circle back now to this question of guidelines. And your discussion about case studies sort of triggered this thought in my mind, and that is that the development of guidelines is probably most likely to be a fruitful activity if there's experience upon which to base the guidelines. And so that's it. It strikes me as a difficult task to ask for, let's say, any country or any region, or even the Convention on Biodiversity, to assign a group to develop guidelines for, let's say, gene drives when there isn't much experience in dealing with them. And so I'm just seeking your reaction to that idea, actually, and that is to say, what would be, does that sit behind the idea of the regulators in Latin America thinking that case studies, whether or not they're actual case studies, because there aren't any at this point with gene drives, but something that's close or similar could be more useful than actual guidelines?
Yeah, Hector, I think I'm talking with the people, the regulators. Regulators want very practical approaches. And for example, when you talk with regulators on food, they say, okay, when we are talking about biotechnology products for food purposes, we have the Codex Annex. And at the end, when you see this instrument, it's a very simple one. It's not incorporating many elements. And I think that has been the mistake of the guidelines that have been proposed, the different guidelines that have been proposed in the past. At the end, they start to be very complicated documents that, because they are including so many things, the countries have problems in order to implement this kind of guideline strictly as the guideline itself is saying. But when you have instruments like the Annex of Codex Alimentarius, or even the Annex of Cartagena's Protocol, the people understand and they start to implement this Annex and can adjust certain things depending of the interest of the country. And I think with gene drives could be something similar. Okay, maybe it's not necessarily a guideline, mandatory guideline that you need to follow, because at the end, there are the potential of having many different products of different nature is enormous. But you could have like at least a list of elements that you need to take into consideration in order to do your risk assessment or to deal with gene drive products. That is how I particularly see a kind of list, if we can call it like that, could be more useful than big documents, very complicated and stating many things. Because at the end, if you have this big document, it's going to be almost impossible to implement it in many countries. If you have, if simpler the document, the more chance of being implemented in several countries. I think that is the idea.
Yeah, I think that's a good thing to point out, and that is that the part of the reason I think that the main document risk assessment that was not approved in Cancun in 2016 was that there were so many layers of complications that were put on it over the years because of people's wanting to include certain elements that they wanted to put into it, that it became an unmanageable document.
Yeah. And another important point is that, okay, you could have the document stating many things, and that is the key part. Inside the countries, you have the people that build its own interpretation, and they are more papist than the Pope. And sometimes you have the intention of the document could be X, but the understanding of certain people is not X, is A, B, C, D, E, F, G, and all the letters. And that start to generate a big misunderstanding and some confrontations inside the country with the different agencies, or even inside the same agency, depending of the person, you start to have many problems. And I think that is one of the main concerns with these big documents and mandatory guidelines. While when you have these short, very brief documents containing the relevant and enough information in order to take decisions, okay, the people have more degrees of flexibility for the discussion, and they can incorporate certain things that they consider useful. I think that is the idea behind.
Yeah, and I think a very practical one. Ivan Ramushana asks a question here. He says, first of all, thank you for an enlightening talk. And it's good to mention Oxitec with regard to the fall armyworm that he's aware about. He agrees with your views that it gets easier if we were to use the gene drive technology in agriculture, but then it becomes more regulated when it comes to human health. Maybe we need to demonstrate such technologies more in agriculture for people to conceptualize how it might work in human health. That is, encouraging agricultural applications so that the experience possibly with the agricultural regulators could then translate to...
Hector, that is an important point. In some countries in which the regulatory framework for agriculture is very well developed, I know that there are some conversations between ministries of health and agriculture, because ministries of health are saying, oh, now that you have experience in your regulation, eventually you could participate in our committees in order to try to build a regulatory framework or to adjust our regulatory framework based on your experience. And that is why it's very important that all this information that has been generated in agriculture or in environment or in health, we could share with the people, and the people can understand in a very simple manner, because by doing that, we are going to have like multipliers of the information, and for sure it's going to reach the key people and the key officers in the countries. Therefore, I agree with that comment.
So, Ivan, that's a really good idea. I'm glad you brought it up, because I think in some respects there's been an attempt to try to separate the agricultural interests from health interests, because there is a feeling among some people involved, at least in the gene drive space, that aligning agriculture and or identifying agricultural applications to gene drives will somehow hamper the effects and the efforts that the gene drive people will have in trying to move the technology forward, because of potential baggage that agricultural biotechnologies might bring to the mix. But it does seem like, based on what you're saying, that it could actually be a different thing from a regulatory point of view, at least in terms of the experience that regulators bring. And that is, it might help if there is, in fact, this connection between health and agricultural regulators because of the experience that they can bring to the table.
Yeah, you know, Hector, I think now we are in a good moment because of the pandemics and because the One Health view is being considered by many countries. Maybe this is a right moment in order to show, okay, in order to respond to the One Health view and to contribute to the to reach the Sustainable Development Goals, biotechnology is quite important. Has many different tools. One of them is gene drives, and start to show how the same technology could be used for different purposes. The basics, the conceptual basis of the technology is the same and could have many different applications. And I think in the same scenario, if we are able to show how the technology could be used for targeting malaria, but with the same principles, we are able to targeting island conservation because we can remove rodents from islands, or we can use the same technology in order to protect crops or silos in which you have rodents that are attacking or destroying the storage. I think the people will understand that, okay, we are talking, it's like we are talking about maths. Okay, the numbers are the same, but you apply the maths in different events with different purposes. I think that is the kind of message we need to send to the people. Okay, this is a tool, and essentially you use the tool in many different solving problems. I think that would be something useful.
Yeah, good. Yeah, that's a good perspective, and brings everything under this, the one umbrella. Brenda Das has a comment here. This is actually has to do with your discussion on the level of guidance, and she says that there's a tension between having a high level document that's broadly applicable, but countries ask for dedicated guidance on organisms or product types. We're seeing this a lot, particularly with gene drives, is to try to say, well, how do we actually deal with gene drives? So generating a document that means everything to everyone leads to a complex and useless tool. But as you mentioned, but then we keep coming back to the same issue of people who have in countries that don't have a lot of experience asking for specific guidance on a specific thing. So I guess I'll turn this into a question, and I'm going to ask, how do you see that playing out when you have countries that will ask for guidance on, let's say, gene drives, and not necessarily seeing things in the bigger picture as far as where this technology fits in, and asking, well, we want guidance on gene drives, but actually they really need more guidance on sort of more broader principles.
Yeah, I think more than the guidelines, we need to work a lot in training, explaining the people, okay, what is the technology, how it works. Ideally, if we can involve regulators in practical courses, because when you see, you believe. when you see, when you touch, you understand the things. And I think the training has it could be a very good opportunity in order to position the gene drives topic, and by doing that, to overpass certain regulatory limitations. Because I think one of the problems, and why some of the countries, even though they are having regulatory framework for dealing with plants, they are a little bit reluctant to gene drives, is because they see that, oh, this is more complicated, involves genetics. And when you start to talk about, oh, look, Mendelian, essentially with gene drives, you can alter this Mendelian genetics. Oh, they say, no, 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 no. Here is very complicated and very dangerous. And no, we need to train them and showing that, okay, the technology is just like a brick of the biotechnology, is a joint point between genetics, application, biology, applied biology, all these kind of things. Because otherwise, if we are thinking that by generating a guideline, we are going to overpass this belief or this limitation from the regulators, no, you can generate a kind of Bible if you want. No, just imagine, and I know because I have seen and I have listened the people saying to me, oh, you know, this guideline, because there are some guidelines available, they say, oh no, it's quite long. I don't have time to read it. And that is just starting by that. Therefore, I think we need to have very practical approaches related to proper communication of the technology, flyers and things like that, in a very simple manner, explaining how the technology works, in a very simple manner, explaining the potential risks. Okay, look, you could have risk on this, on this, on that, but not generating big documents or treaties about that particular risk, because the people, and even more now, they don't have time, and even they don't have interest. And if you have a big document, they say, oh, no, no, it's better to be safe. We are not going to move the things forward. As easy as that. I know that it could be like a joke, but it's not like that. I have seen these kind of behaviors with regulators in some countries, at least in Latin American countries. In some
I think that's a common thing. It's not just Latin America. If it becomes too difficult to go through these guidelines, the easier approach, especially if you're a regulator and someone under some kind of pressure to deliver a decision in a certain length of time, which many of the people in the regulatory system are under, then it's an easier decision to say no than to make the effort to go through with these, make sure that all the boxes are ticked in a complicated guideline. I'm going to make, Ivan has a comment here rather than a question, but I just want to make sure that it gets read out. Ivan says that I think he's talking about in Kenya and more particularly with people involved in biocontrol generally, is working now towards a One Health approach and foresee the future where they can use gene drive to achieve One Health, i.e. human health, plant health, animal health, to address the multiple end users' needs, which is exactly what you were saying. So I think it's a good approach to take.
Yes.
Dave has raised his hand again also, and I think I'll use that opportunity to give him the last word, and then I'll close the session because we are coming up almost to time.
Mhm. Mhm. Yeah. No, agree, David. Thank you.
Thanks, Dave. And actually, we don't have to limit it to questions, so it was a good thing that you that you made that comment. But it does look like we are coming to the end of our session. We only have a couple of minutes left, and so I'm just going to thank you, Pedro, for a very good talk and a good discussion afterwards that really gets us a better idea of how the Latin American countries address these questions and also how they approach the negotiations, how they provide their own views and the opportunity for their own views to express themselves in the negotiations at COPMOP.
Mhm.
So thanks very much.
Thank you.
So I will then remind people about our next um, our next sorry our next talk, which is going to be next week, May 25th. It will be the final talk in this webinar series, and it will be provided by Dr. Viba Ahoja, who's the manager of the Biotech Consortium in India. And she will be giving us a similar perspective to what we've been hearing about in the different geographical groups, but this time on the COPMOP decisions and COPMOP negotiations regarding gene drives in the Asian region. So we're very much looking forward to her describing to us what's going on in that part of the world. And so with that, I'm going to end this webinar, and thank you again, Pedro, for your presentation. It was a great one and stimulated some good discussions, and we're looking forward to continuing and hearing how the Latin American countries participate in COPMOP coming, well, we hope sometime this year, but it's not necessarily clear whether that's going to happen. But anyway, we'll keep our eye on that space.
Okay, thank you very much, Hector, and thanks to all of you for being with us. It has been a pleasure. Thanks a lot, and take care.
It's been a pleasure here as well. Thanks a lot. Goodbye.
Hi. Oh, all right. Hello. Hi, how are you? Doing well.
Hey. Well, that went well again. Yeah, it was pretty low.
No, it's sorry. I thought I hit start and I thought I hit start and didn't realize that it didn't actually start until Jasmine hit it like right as Hector was starting to speak. Well, they would have had that general, the webinar will start soon landing page. Yeah. So if they join before we've started the session, they still hit a landing page that says it'll start soon. And so it would have started like right at like 11:01 or 2, and then they would have all joined.
Mm-hmm. Okay.
Yeah, sorry about that. I enabled the language interpretation, I hit record, and then I thought I hit start. It didn't actually fully hit start.
Yeah. 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 Yeah, and I think I was kind of disappointed, but hopefully there'll be more views when it gets put up. And so, but I think otherwise technically it went well. I liked the fact that